I've been getting frequently is, how can a chiropractor help me during these times? My name is Dr. Jason Cardinale, and I'm from Proactive Family Chiropractic Center right here in Erie, Pennsylvania, where we have been helping people with back pain, neck pain, and headaches for years, and we have an excellent track record of doing so. Not only am I a chiropractor, but I am also a state licensed nutritionist as well as a certified trainer. So not only have I been fielding questions about chiropractic, but also about nutrition during these times and also at home exercise. So I'm hoping to address some of those issues with you today. But what I want to start with specifically is, how can a chiropractor like myself help someone like you who may be dealing with pain and is unable to get into an office? So, and this is very common right now. We have tens of millions of people that are working from home. Maybe you are one of them, and you're dealing with some issues and you're not really sure exactly how to resolve them. Now, doctors and hospitals are asking people, if you don't have a true emergency, to stay away from the emergency rooms. Harvard University actually said that 3 million people per year will visit the emergency rooms with neck pain or back pain. That's a lot of people. And at this point, there's a lot of sick people in those emergency rooms. So there are definitely other ways that you can get relief. There are many world-renowned organizations that have said chiropractic is a great first-line defense for some of these issues: neck pain, back pain, or other sorts of muscle and joint pain as well. And right now, you would think that with people working at home, maybe they're not doing as much as they used to, that back pain is going down. That is not the case. We are not seeing that at all. We are actually seeing back pain rising significantly. Think about this. People are working at workstations that were not exactly designed for you to be sitting at for 8 hours a day. Your kitchen table, your couch, maybe your counters in your kitchen as well. These are not places that you would want to spend long stretches of time. But right now, we sort of don't have a choice. All right, so we are definitely seeing back pain rising significantly. Now, typically, how I would normally help people is, people would come into my practice. We would do a very thorough assessment, and we would start to see, where is this pain coming from? Specifically, what tissues is this pain coming from? And we would create a treatment plan designed just for you, and it may consist of chiropractic adjustments, some active care with stretching and exercise and things of that nature, maybe some soft tissue work. Those of you who know me well know that I love to use a tennis ball for soft tissue work, and you can even use a tennis ball for some soft tissue at home as well. So now the question is, if you can't come into the office, what are we doing? So we've had to adapt as an office, and we are currently offering telehealth services. And so these include at-home care programs. This would consist of stretching, exercises, and again, that soft tissue that I talked about as well, maybe even a tennis ball, because I do like to work with the tennis ball. Ergonomics assessments of your workstations at home. Again, these were not designed for long-term use, but unfortunately, that's where we are right now. So I can take a look at these workstations via video conferencing and see if I can give you some recommendations on changes that you can make to these workstations. Now, when you sit for long stretches of time and maybe in a bad chair or a bad position, this is going to change how you move. So we're also offering movement assessments. Based on the findings from those movement assessments, we will also prescribe certain stretches and exercises to make sure that you are as pain-free as possible. Now, lastly, as I mentioned earlier, I'm also a state licensed nutritionist. So we are doing nutritional counseling and assessments to make sure that your body is functioning as well as it possibly can during these very uncertain times. So if you would like help with back pain, neck pain, headaches, maybe some sciatica, you're having some ergonomics issues while you're sitting at your makeshift desk, or you have some nutritional concerns, I encourage you to reach out to us. All right, we are reserving a certain amount of these appointments. There's not a lot, and they have been very popular. So I would definitely recommend that you get in contact with us. The 3 best ways to do so are Our phone number, 814-836-4663. You can email us at beproactive@proactiveerie.com. You can also connect with us on Facebook. Our Facebook address is facebook.com/proactiveerie. I would encourage you to do this sooner rather than later because, like I said, these are very popular appointments because there's not too many other choices out there as far as getting the care that you need. So please contact us, and I look forward to seeing you either in our office or online. We'll talk to you later.